right, I'll get started. Thank you for joining. I want to present you the title first. So the implications for sensory processing disorder and intervention. So you are probably familiar with the four functions that most BCBAs will talk about when you first start services or throughout the services during parent trainings. We have the function of gaining attention. We have the function of access to items or activities. So attention, actually, let me explain a little bit in case you're not familiar. So basically, attention is somebody will start crying because two adults are talking and they're not engaging with the child. Okay, so that's the function of attention. That's an example of how it could look like. There are many ways it could look like. We can discuss. If you have any questions, please feel free to post it in the chat, and we'll get back to it towards the end of the session. Besides the attention function, we have access to items or activities, and this will look like maybe trying to elope, leave the room to gain access to a particular toy or game instead of asking for it, right? So gaining access to activity, or there might be a tantrum when you said no tablet anymore, right? Or when the tablet was time was over. Another function is escape, and this maybe somebody who's already experienced some academic goals or any other task that might be non-preferred. That in that case, then we might see escape behaviors. That would mean that the child might not want to engage in that activity, and they will display a maladaptive behavior, possibly to show us that they do not want to engage in that activity. Now, a response for this would be functional communication, but just discussing the function. So we discussed attention, we discussed access to items or activities, and the third one, escape. Now, there is a fourth one that is sensory function or automatic function. And this is usually the most difficult to understand for parents, for us as the providers. And it is really, in some sense, could be more difficult. Way to explain the sensory function is by understanding that the child prefers to do this, whatever behavior might be that is sensory stimulated, because they like it, right? So they will engage in a behavior because they like the feeling of it. And they might start making some noises because they like how it feels on their throat. They might start unfortunately, sometimes hitting their head because they just like the pressure. They might start chinning and pressing against something, overly doing so, right? Now, of course, there are different ways to deal with those. And first, I just want us to discuss everything, and then we'll come up with some strategies and discuss towards the end. So, one second. All right, so sensory processing, right? Then we have a sensory input, whatever that might be, that is too cold, that is too bright, that is somebody sitting too close, somebody is not close enough, and all that categorizes as sensory input. And basically it's information gathered by from the environment by our senses. So then what happens next is the processing stage, right? Sensory information is organized and interpreted, stored, and related to previous experiences. So this processing is where the differences come between kids and between adults, right? And in between each other, because we all have a processing stage that might display differently from one to another. And then here comes the response based on that processing. Then a response is generated. Then the response, of course, is going to affect the next sensory input, and so on. So that's just overall how it looks like. All right, so it's very common that we go through this stage, like all of us, right? But we just sometimes don't realize it because we have a typical processing level, right? We are not noticing, like if let's say we're sitting home and reading a book, we're not noticing going on around us. We're not being bothered by the feeling of the chair around under us. We're not having to think about how to keep ourselves balanced, and we are not we don't, like, we are able to adjust the temperature if we're cold, or getting a blanket and so on, right? So we have those needs, but because of the processing section of this process, it's typical, then we do not have to worry about it, right? We don't even think about it. However, there are some people and some kids that we might be familiar with that do not have this typical processing stage, and then it results in them having different responses. Okay, now I want to talk about seven senses, and you'll think that, wow, where did they come from? But really, that's what we can discuss when it comes to behavior and how it relates to behaviors, right? So we have the touch sense, we have the vision sense, we have auditory, we have taste, we have smell, we have vestibular and proprioception. And we'll discuss all this separately. So of course we have the touch. I think all of us were very familiar with it. It might go sometimes deeper than when we think, right? Because again, we're so used to touching everything and it feels normal to us, but some textures are very different, right? Like when we're more sensitive, some textures are very different, right? For some kids, so we'll see them reacting differently to when they touch you. I don't know, jelly bean, something shiny, something furry. We might see kids that do not want to pet a dog, right? And this is because they are very sensitive to that touch. Or we'll discuss later what might create that need to step back. Okay. So light touch, vibration, temperature, deep pressure, pain, that's all we feel by touching, okay? This is a child that gave this evaluation of their state at that time, and they were saying my worst problems were touch as a kid. When I was a real little kid, I had to wear those scratchy, awful clothes, scratchy petticoats, and things like that. I actually hated it. And even now, I have problems with buying pants that itch. My main thing was tactile. I also had some sound sensitivities. When I was a little kid, I was terrified of balloons because I never knew when they're going to pop. Right. So you'll see here that in their statement, it seems like things are getting better. They got used to that scratchy feeling, where now they only have a little bit of a sensitivity, but it's still there, right? But the reason I'm actually presenting this and what we're hoping to do here is all of us around the kids that might have these needs should understand and be sensitive to it, because it's not like they are choosing to not want to wear these pants that you just bought. They are just their skin is not ready to take it, right? All right, we'll go further. The vision, the ability to see clearly, look and track moving objects, and bright light sensitivities. All right, auditory, listening, filtering the excess noise, varied tones, right? Some kids are very sensitive. The moment you raise your voice a little bit, they will react, they'll start crying, right? Or they will not respond well if, like, to a male voice or a female voice, and so on. All right. Taste and smell, handling the different tastes and smells in the environment, right? We are very much familiar with this. We know plenty of kids that have a high sensitivity to what they're tasting, right? And they are very picky with their food. I'm sure you all are familiar with it. Smell. All right, vestibular. This is a new one, and I'm sure you might have questions about it. So basically, what this is the balance, is the muscle tone, the body's ability to understand where it moves and which way is up and down, back and forth, and so on. And these are your kids that will maybe bump into the wall or fall very often, right? We do have a kid who sometimes, like, she will look at you and she will turn and look at you, and then she will walk into a wall, right, as she's turning. So that's what the vestibular means. Proprioception, this is when our muscles and joints help us providing information that tells us where our body is in space. So it helps us determine movements, how hard to write on a paper, how to throw a ball to reach the other person and not above them or under them, right? And so on. This will help us when you have a cup of water, you will put it on the table with the proper speed and softness, so that way the water wouldn't splash, right? This is a muscle memory that we already have. However, I'm sure you're familiar, like younger kids, however, like they still learn it, right? Because it's a muscle memory that we know when we put a cup of water on the table, we have to put it soft enough that the water wouldn't splash, right? So in time we learn how hard can we put that cup on the table, right, in order not to splash. All right. Sensory processing disorders, and we have a couple of different ones. And so we have sensory modulation disorder, and this is split in 3 different ones, which we will all discuss separately. So sensory over responsivity, sensory under responsivity, and sensory seeking. Then we have the sensory discrimination disorder, and here we have all this touch, smell, auditory, and all that. And then we have sensory-based motor disorder, and those can be postural disorder, right? Like the way we sit and we stand and so on. And dyspraxia. And this one really refers to the balance per se, okay? All right. All right, so let's see what overreactive is. This will show us prolonged reactions, exaggerated reactions, reactions to stimuli of weak intensity. Okay, so even if for one of us having a noise going on nearby, or having this cat go by me is not going to bother me. There might be some people that are overreactive to a distraction like that, right? A visual distraction. Or maybe if there is a little bit of music on the background, it might not bother me. Some people will be bothered by it, right? Some people will like cooking with some music on. Some people like cooking without anything going on, and they might ask their partner or somebody else to take the kids in a different room so they can focus on what they're doing. Then seeking. Now we have seeking sensory, craves more sensory, and it is attracted to a lot of sensory input. So you'll see the kids touching everything, checking textures for everything, holding this, pushing it, see how far, how heavy it is, how soft, how warm it is, and all that, like always looking for things, moving around, and touching things. Underreactive, those are going to be high level of tolerance to environmental stimuli causing or or a little or no reaction. So this will be the kids that are absolutely okay with having music blasting, right? And they continue to like focus on one thing only. Or they will be the kids that you will talk to them and they're still focused on what they're doing, and they will not hear you. They will sometimes seem lethargic because they don't have that sensory input, right? So they don't really react so fast to all that is going on around them. So they might seem lethargic because like visually, and they prefer sitting a lot of the times. They don't want to interact with a lot of different items because it doesn't seem interesting to them, right? And then they might seem disengaged, right? Again, they don't want to, like, they're not interested in squeezing a ball because they don't really feel anything about it, so they don't care. All right. For overreactive, so you will see kids that might cover their ears when loud noises are around, right? Is sensitive to bright lights. They will cover their face, or they will try to leave. They will, if there's too much movement, sometimes they will try to leave the area. If there are too many people in one room, they might not like it. You might notice that when you take the child grocery shopping, or to a supermarket that has like very bright lights, then they might not like it, and they might want to go home really fast. Avoid touching certain textures, grass, sand, finger paint, squishy. And I heard so many kids, so many parents, oh, I love going to the beach, but I cannot take my child because they do not like feeling the feel of the sand on their feet at all. They don't want to touch the sand. They don't want it near them, right? So they are being overreactive to the stimuli of the they receive from the sand, from the sensory input that you receive from the sand. Okay, overreactive also, often irritable, aggressive, impulsive, and moody, has a poor tolerance to transitions. Frequently cries and hard to console, right? Because they're affected by everything. So it's just hard, because sometimes it's also a vicious circle, right? Where I don't like noises, but I'm going to start crying because I don't like them and I'm so stressed about it. And then I cry and there are louder noises, right? And then people come and talk to me and I don't like that. So it just keeps going. So it's very hard for the child to get back to a baseline because of that. Does not like to be held or cuddled, right? Because there might be too much, the pressure might be too much, and you might hear, oh, my child does not want to hold my hand in like when we go somewhere, and they might even be a risk of like of elopement, or just zooming out of from being next to you, right? So of course it is an issue, right? Because you want to at least be able to keep them close to you. Transitioning to new foods, and again, this is something that comes up all the time, right? It's always uh, there is always an issue with food, right? Like, oh, we only have 3-4 things that we choose to eat, right? And the child will just not touch something else, period. I've had a lot of parents discussing how many items the child is accepting at the time, but also how they roll throughout time, right? So like right now there might be only 3 foods, and then a couple months later there might be 4 foods, and then in a couple months it will go back to 2 foods, right? All right, underreactive. Now appears slow, unmotivated, unaware, or withdrawn. Has flat effect much of the time. So basically, like you're trying to get them to paint. They will just paint, like put their hands, right? Like let's see hand painting. They will put 2 hands there because you're making them, but they don't have that excitement. They don't feel the sensory as much as other kids might, right? And they're not interested in it, right? Why am I doing it? Because I'm not feeling good about it. So it comes to like the point where like I don't want to do it anymore. So then I'm not motivated to do it, right? And then I will not do it. Okay. It's hard to engage, might observe but not participate, seems to be lost in his own world. Okay. Remember, feel free to add any questions to make sure that we don't forget them, so that we can answer them at the end of the session. Sensory seeking, those are the kids that will really want to touch something at all times, okay, and has a high activity level, seldom sits still. looks very much like ADHD, but they're really just looking for sensory activity. So maybe that's the differentiation where like you actually are looking for things that will give you some sensory input. You're looking to touch, you're looking to see lights, you're looking to see things spinning, you're looking to see to put your hands in like in putty or Play-Doh and cover them in rice and sand and so on. Hangs on people, objects, they want to be touched, they want to feel the pressure of somebody holding their hand, they want to feel the pressure of somebody maybe like hugging them a little harder or just hugging them. They want to have somebody talking to them to hear things. They want to hear they want to see, I don't know, cars going by. They want to, I don't know, see different colors and move a lot. They might have some rocking or some steaming behaviors that might be observable to us. Smells or mouths, everything, right? So this will have the kids that will put everything in their mouth. They want to see how it tastes. They want to see, they feel the texture with their mouth. They want to have something in their mouth all the time. They like the pressure of chewing. They like the pressure of having something in their mouth and pressing against it, right? So there could be different reasons for which kids will put something in their mouth, right? Either the pressure, either they really want to see how it tastes, they want to see what the feeling is when they bite out of it, right? And they will try different non-food items, right? Like these behaviors can become dangerous. The kids will seek out loud noise, likes to watch bright spinning objects, is excessively affectionate, might be demanding or hard to calm. It's a risk taker, right? You'll see the kids climbing all the way in all the trees. You'll see the kids coming, like climbing everywhere in when they go to a playground and not be worried about it. Rock climbing and all that, they will be ready to do it at any time. Okay, so we are overreactive or underreactive, and we just going to like apply an intervention to try to get to that medium, happy medium, where the kid is going to be comfortable being in a public space, have behaviors that are socially acceptable, and still enjoy every activity that happens when they go outside. All right, so now we're discussing interventions. So for sensory integration, we have a therapy for sensory integration where we can help them slowly accept new activities and so on. Occupational therapy, I'm sure you are all familiar with it, applied behavior analysis, and hippotherapy. Now, what we do as applied behavior analysis is we like to work with everyone and just kind of getting everybody on the same page. Usually that's the most efficient, right? We want to make sure that we try everything and we use all the strategies that might function. Now, when we identify the behavior that might be a maladaptive behavior, which means it restricts the child from learning, or it restricts the child from having an independent life, or it restricts the child from having access to the community and activities that are appropriate to their age, right? So let's say as an example is all right, you like going to the park, but when the kid goes to the park, they try to hug everyone very hard, and obviously the other kids don't like it, especially because it's a new child that they don't know. So of course it's becoming a problem, and the parent is very likely to say, oh, we can't go to the park because the other kids so on, the parents are saying stuff and so on. So that's where we want to come in, and we want to make sure that whatever we have to do is being done, so the child does not have to be secluded from participating in those activities, right? It's a sensory activity, it's a sensory input processing issue. Then we have to work with that and not create a bigger issue for the child, correct? Like, we don't want to now have the child not be able to practice any social skills, right? Because they cannot go to the park, right? We do not want to have the child not practice more, like, motor skills, right, when they go, like, to go to the park, or like maybe engage in some sports, because they cannot go to the park, right? So we have to work on that particular issue, so that we don't create more issues. And so that's why I believe it's very important that we all work on identifying those sensory input processing disorders, so that we can work on it and not limit the child from being part of the community, or attending like some work activities, now learning activities. Now, besides that, we also have seen very often that those sensory issues could also be dangerous to the child, right? And that's when we take it a little bit more serious. I have seen kids that had behaviors that were under a function, under sensory function. So basically, they were doing it because they liked it, and the behavior could look such as headbanging, but headbanging to a point where it really created pressure and created concussions. So obviously that is extremely dangerous, and we want to find ways to lower the intensity, or decrease, or replace altogether, right? Eliminate altogether, put it on extinction. All right. Sensory integration, right? So that's what, like, it helps maintain a controlled state of optimal arousal level that is crucial for academic achievement. Teacher teaches the body how to process sensory information in a typical way, right? So it desensitizes. And this could look like deep compression massages, then tactile integration, might have the weighted vests, the weighted balls that, like, they can carry around and, like, play with them, hold them, push them in a cart, to feel the pressure, right? To help them understand what pressure, what they should actually feel, right? If they're maybe on a lower side of sensory input. All right, for hypersensitive children, and these are the kids that overreact to sensory input, right? So, like, it's too much for me, right? That's what that is. It's too much. The light is too much. The noise is too much. The touch is too much. You're too close to me. It's too cold. It's too wet. It's too. I don't want to have my hands wet, or so on. So we'll have to make a slow, gradual introduction to a new sensory feeling. Do not force the child to move, taste, touch things, which cause a significant fearful response. The child should know what he's doing ahead of time and while engaging in an activity. Allow the child to experience sensations when he's ready. You can try to creatively find ways to get him to do it, right? And we were talking earlier, for example, for the paint on the hand, right? So let's say the child does not like to have anything on their hand, on their palm, right? A lot of kids might be sensitive on their palm. It's a sensory area. It's a sensitive area as it is. And then they do not ever like something on it. Some kids will not even like getting it wet. They don't want to wash their hands. So maybe putting paint and playing and being creative, it might open their horizons a little bit to understand that it's okay to have that, and their body's getting used to having something on their hand as they're having fun, somehow to trick their brain that, hey, this is so much fun. It doesn't really matter that it's uncomfortable, that uncomfortable, right? So that way they open their body to accept that, and then we'll continue to maybe process that towards water, washing hands, and so on. Now, again, as I'm telling you, it all goes all these interventions are needed when the child is affected. Okay, of course we don't, there might be some stimming behaviors, some sensory function behavior that are not really affecting the child, right? It might be a little flicker of the finger, it might be a little twirling of the hair, really. We, and in that time, at that time, you maybe just have to weigh a little bit, is it worth like working on it, or we can work on something else? Is there something else that is or we should prioritize to that? If it's not dangerous to the child, we really don't need to look at it. But as the example I gave earlier, not washing your hands, it will create an issue at some point, right? So it's not okay, it's not safe, right? So we have to change that, and not let things happen. All right. Be patient, allow extra time. Okay. As a child, what is making him feel anxious, sad, and angry, right? Because there might be different reasons. So let's look at, a lot of kids have difficulties having the toilet flush, right, when they are there. So we have to ask and communicate to the child, right? And I know it's more difficult when the child is nonverbal, and we always can give options, pictures, to try to identify what is that is making them anxious. Is it the air pressure that comes out of the toilet when it is being flushed? Is it the noise? Is it the fast movement? Is it the whirling of the water? What is that is making it's worrying them? Because a lot of the time it's just one thing, we just cannot identify it immediately, right? Especially if the kid is nonverbal. And even if they are verbal, they might not be able to identify it, and we might actually have to come up with like some options and some suggestions to understand, to help the kid understand that, okay, these two things can be separated. What am I actually worried about? Or also he could be probed, right? Like, so we can probe something that has a similar twirl, or we can have something that has a similar like noise, right? If we expose the kid to a noise in a different environment, are they still going to be scared of it, right? If we expose the child to a fast movement of the water, like to a cascade or something like that, are they still going to be worried about it, right? So then we can identify, okay, what is exactly the sensory input that they're getting that is bothering them. That way we can find replacements. We can try to help them slowly integrate that noise, that feel, and so on. All right. Give them words to use to express their feelings. Again, so if we cannot give words, we cannot give pictures, we can go by trial and error. Let's see, how does the child react to, all right, they do not like going to the beach. Okay, we don't know why. Is it the water? Is the noise of the water, the waves? Is the sand? So maybe we can put the sand in a box. If they like the sand, then it's not the sand, correct? Then if we put the water sound on a phone and they're okay with it, then it's not the sound, right? Like, it's not the noise that you hear on the beach. So it really, like, there are ways to identify, and we do have to help the kid, like, slowly getting into it. So if we don't know, we will not be able to help them. All right, treatment guidelines for hyposensitive children. So those are the kids that underreact to sensory input. And we can make the child aware of his body parts through heavy work, input, or sensory play. Use as much deep pressure and heavy work as needed and tolerated. Have the child do activities in a variety of positions, sitting, laying on his stomach, propped on his elbows, sitting on a therapy ball, and so on. Sometimes like I suggest parents, maybe you want to take the dirty clothes hamper and have them push it all the way around the house, right? See if they that it can help them, right? Depending on, like, what their needs are. But you can use things within the house. There are different ways. There are like some pens that might offer vibration as they write. It's harder to write with, but it helps, gives them that additional stimulation. Sometimes Play-Doh might work to offer that pressure when you look for something in the Play-Doh, but they're therapy, or I think that's what it's called, like the even heavier one, more dense, that is even harder to model, right? Okay. Things to help your hyposensory child, right? What are some activities that they can do, that we can suggest to them, to help them better get that sensory input that a typical person will get easier, right? They don't have, not everybody has to do this, nor that not everybody has to go running to feel the sensation of it, right? The sensation of like activity and like movement and so on. Carrying weights, right? Like sometimes just like walking around might not be pleasant enough. Like you need to in order to feel your body moving, you might want to carry some weights. Wiping whiteboards, right? Loud music, finger painting, pressure sandwiches, modeling clay, jumping, trampoline. I'm sure, like I know a lot of the parents are using this as a tool, and I think it's great. Jumping, wiping the table, right? Like they putting deep pressure on their hands, offering hand squeezes. Sometimes really just offering massage, maybe feet or hands or body overall. Spinning, allowing to spin. Back shoulder rubs. So all these could be ideas to help the hyposensory child, right? Heavy work activities. Why and to whom is it important for? The children that are jumpers, leg shakers, crushers, those that can't sit still. Regular heavy input into their neurological system will help calm them down, right? They are already getting that by a structured activity. They don't have to go and kick somebody's Legos down, right? Because they already get it. They are already getting that sensory feedback by doing a structured activity, a positive activity, right? That you are proposing. The reason behind these activities is to help their body receive regular input into their muscles and joints in the most appropriate ways so they can get input they crave and settle their bodies down. Right. Often these activities will include using weights, weighted products. We have weighted vests, weighted blankets, jumping, bouncing, rocking, pushing, pulling, swinging, and being squished. Sometimes tickling. A lot of the kids love that. All kids need this, but our children with underreactive neurological system will need it even more. These activities are truly used for most sensory processing issues and can have an amazing effect on the nervous system for regulation and modulation. We have some occupational therapy suggestions here. So therapists figure out why children are experiencing difficulties with typical daily activities. They develop strategies to help those with sensory processing disorder adapt and participate in the world by controlling their reactions to sensory input. Sometimes there might be no replacement, right? So we really have to work on ways to maybe different coping strategies that could be used instead of that sensory processing, right? So I want so badly to bite somebody right now, but I will use a coping strategy of hand squeezes, or I will bite on a chew toy. sensory focus on getting those with sensory processing disorder to the optimal level of arousal, and special sitting arrangements could help, right? They might want to be closer to the teacher. They might need to be further from the teacher so that it's not too loud. They might need to be seated by the window so there's more light. They might need to be seated away from the window. So that would always be very helpful. Apply behavior analysis. The facilitator tries to understand the behavior displayed by those with sensory processing disorder. And what I was talking about, this is what I was talking about it earlier. There are behaviors that that could look the same but have a different function, and that's where we come in place and really identify, is that a sensory behavior, or are they doing that because they want attention, right? So if I might have a child doing all the time because they want to feel the tinkling in their throat. Some kids might do it because one time when they were sick and they felt the need of doing that, they did it, and mom, dad, or whomever, the teacher, came to them and sat next to them the entire time because they felt bad for them, right? So now what the child knows is that when I do this, somebody comes to me and hangs out with me, offers me their attention, right? So this same behavior could be a sensory function behavior, but could also be an attention function behavior, right? Me trying to push a door open, or push things around, or flip tables, might be a sensory processing disorder, right? Where I really want to feel that pressure. I want to move. I want to push. I want to feel the heaviness of things, right? Or it could be that that I want to get access to the phone, and I don't have the access to the phone, and my mom is not allowing me to use the phone. We do work on identifying the function by collecting the anecdotal records and graphs, and graph the data of the behaviors to determine its function. And there are a couple different, like, tools that we use and to identify the correct function. Sometimes it does happen that a function of the behavior could be dual. So there could be a sensory function, and it could be an attention seeking function, right? As I was the example I gave earlier, it's possible that I will make that noise because I like how it feels, but I also make it because I know that somebody's going to give me attention, right? When I do it. Screaming, the same thing. I might like the noise of me being loud. I might like the loud noise, but I might also want to get everybody's attention. I might also want to escape some work, right? So it could be it's possible there are two different functions. However, sometimes working on a sensory processing disorder might help with the other function as well, right? Because we're now finding different ways to get that sensory input, and we're not going to be interested in getting to that activity anymore, right? Then we have new leisure skills, and we are able to participate in more activities. We're able to go out in the community. So we will not have that, behavior that often anymore, or at all. Establish replacement behaviors so they are more functional, right? So now there are many behaviors that could have a sensory function, and many replacement behaviors. And I was looking around at my colleagues, and I love looking at some ideas and their imagination on how you can replace I don't know, eating sand with eating some sort of like tapioca or something like that, like putting something like that. There are different replacement behaviors for everything that there might be, right? We have kids that like might just lick the floor, right? We definitely have to find a replacement behavior for that as soon as possible. And really what I think our mistake is, and sometimes as parents and as like providers, and we're just expecting a child to stop doing that. You cannot lick the floor, period. That's not going to happen, right? Realistically, it's not going to happen. That is how the child is getting their sensory input. They are not going to stop it just because you're saying so. A lot of the times the likelihood of like of that particular activity, it's so reinforcing to them that there is no way you can compete with something else, right? With another activity or another whatever, you might play a song, we might not work, right? So you have to offer as a replacement an activity that will offer the same sensory input. And if they like sitting on the on something wet, you might want to put like a nice icy seat on their top on their seat, right? And they might feel the same. If they like to lick the floor, maybe we can offer something such as the baby teeter to lick the bag instead, right? Keep that safe and clean and so on. Maybe ice block, or maybe something that could be offering them the same texture, the same feeling, but be safe, right? So we always have to find those replacement behaviors and not just expect that the kids will start engaging in those behaviors, period. We really cannot expect that. It's just it's unrealistic. I don't know if any of you have any advices or anything that really is bad for you, but you will still do it. Like, I don't know, eating McDonald's French fries, or smoking cigarettes, or I don't know, whatever there might be. If anybody that you might know has those, imagine asking them to straight just cut it out, right? It's really unlikely that that will happen, okay? And if that does happen, that's in very few occasions. Okay. Hypotherapy provides hypotherapy provides upper level motor experiences, which controls active interactions, provides lower level of motor skills. So like basically it's just giving them that pressure, that constant movement. There are some individuals that are specialized diet, like wheat free and gluten free, that helps. It hasn't been like it doesn't work for everybody, and it definitely does not cure autism. What it does sometimes is like it creates, especially with the kids that might have that sensitivity, helping them like have a good tract, then you might help them in their behaviors as well, right? Of course, it's not like scientific, it's not proven as yet that is like strictly related to autism, like, or like that it helps in any way, but there are been some kids that have been helped by that. And I think a lot of the times, really, if the kid is intolerant, it might not come up with an allergy, but they just do not feel good, and right, you're gonna have some behaviors when you do not feel good. Combination of therapies is most effective. People get too married to single theories. The really good teachers can kind to fit in of the therapy that fits the child, right? So we are not going to be stuck. This is the only thing that this kid is going to work with, and that's what has to work for him, right? We have to try, because every kid is different. We know that, right? So for everyone there might have different needs, and there are different strategies that might work for them, different therapies, different sensory input from different perspectives, and we just have to find that particular one that works for them. All right, so basically we just want to offer all the options to make sure that we're doing everything that we can to support them, because it is a real problem, right? Like the kids not necessarily, they do not walk into that they do not want to walk in that supermarket. They just really get overly stimulated. They will have a hard time, and then they might get into a tantrum, and we're wondering why, right? Sometimes being nonverbal limits their ability to express that, right? And again, as I said, even verbal kids, they do have that difficulty sometimes, because they have a hard time understanding this disorder as well as we do, right? They don't know what exactly is happening, but they know that when they go under that very powerful light in the supermarket, they do not feel good, right? So they might not be able to explain. That's why we have to be very mindful. And every time when a new behavior comes along, it would be great to do this functional analysis of like, what is the function of the behavior. We need to know what the function of the behavior is, and if it's sensory, let's see what we can do. Where are we fitting into? What do we need to apply? What do we need to use? Where do we need to bring the kids, and how we can help them? And those are some, I want to make sure they have some time for your questions if you have any, but I'll quickly read this. So those mild reactions that you did have, were you aware that they were different reactions in all the people around you? And a person under this spectrum will say, I did. I just thought that everyone, I didn't know why I had the problems. I mean, I just thought that people were so much stronger than I was. You see, when I was a kid, nobody knew about sensory problems. I somehow thought that other people were stronger than I was. I didn't know what was wrong. People just didn't know about it. So there comes some lack of confidence, right? Like, everybody else can do this and I cannot do it, right? That's why another point for which is so important that we identify this and we communicate to the child that that's okay. It's just that you are different, and we're all different, just to different things, right? And there are much more awareness of it today, right? And they respond, there is awareness of it now, yeah, but when I was a kid, no one was aware of it. And I think we're trying to just spread this awareness, make sure that no child has to go through this without being aware of what's happening, right? And the people around them to be aware of what's happening. When they would react to you strangely, did you realize that they were upset with you? Mother realized that scratchy things bothered me, so we did do things to try to prevent the problem. Like I had some wool pants that were lined, but there still was an exposed seam. I took an iron and a tape and put it over the seams. So there are ways to do things if you want to help, but in order to want to help and find the ways to help, you really have to identify the issue first. So admit it and recognize it. And we have some references here. I do not see any questions in the chat. If you do have some questions, you can also unmute yourself and raise the questions now, so we can discuss. We can come up with some examples and some strategies that could be used. Or if you have an unrelated question, we can also go over that. Let me know what the questions might be, okay?